me desperately trying to save my long hair for 15 years using penguin coat cap. 33 sets of daily radiation only to discover the blisters bursted out like wildflower on me. Luckily, I have my mom with me. She enabled me to understand how difficult it is to care for your loved one. I feel guilty that I make her age a lot. This is why I decided to dedicate my life to not only to patients like me, but also helping the elderly like my mom. Anyone surprised by this data? According to APA, 75% of Americans are stressed. Self-care behavior change is difficult, even more so for the 72% who's isolated and lonely. So I wanted to show you a quick video. Hi, my name is Amy Lee. I'm founder of Dance for Healing. 77% Americans suffer from physical symptoms due to stress, 73% psychological. I was one of them. In 2011, I ran a marathon. In 2012, I was fighting stage 4 cancer. It was very hard. I won the battle, discovered the healing power of music and dance, now inspired to give back to the community that supported me. When people get sick, they not only have physical fatigue, but also huge mental stress, and become a roadblock to help them heal better. Creative arts therapy improving quality of life for cancer patients by 50%, reducing pain by 59%. Dancing frequently will reduce the risk of dementia by 76%, increase serotonin, oxytocin, and make you feel more loved and trustful. This is crucial for patients who's going through the most difficult challenge in their life. Patients are also homebound and very easy to fall into depression. We specifically designed our virtual dance platform to address this problem. Based on neuroscience, Dance for Healing uses AI, behavior design, and gamification to recommend personalized music and dance based on how you feel right now and your health condition over time. Enable them to dance with friends, family, cancer buddies, anyone, anytime, anywhere in the world.
Now open your eyes.
These are real patients who's dancing.
Open wide.
In April 2014, we launched our first pilot. Let's see what the patient had to say within 4 weeks.
It's just a great class for me. I tell everybody, I wasn't sure about when you're on the computer. Virtual. I like that now.
I just think maybe I only can dance for 15 minutes.
Yeah.
But now, just say, see, I have some muscle here. I can dance for an hour, no problem.
Yeah.
Really, get my energy back.
I met an amazing group of people. We are open-minded. We want to try new things to help us. We are very brave, I think. And we dare to express ourselves even we know that we are not the best dancers in the world. So we are so fortunate to have all the amazing teachers. You really made a difference in our life.
Thank you. So now you understand what we do at Dance for Healing. So this is a 28 research paper review by NIH Presidential Fellow. The pain data here is especially impressive. In the initial study, it was 54, and the follow-up it went up to 59, which means the benefit, it's not just placebo effect, it actually sustained. Moderate exercise, the one that make you sweat, increase blood flow by 200% and reduce tumor hypoxia by 50%. And because the oxygen level increased in the cancer cells, now these cancer cells will actually respond to treatment. And we all know every single cancer cell we could kill. That's another chance for life. 1 in 3 dollars in Medicare will go to Alzheimer's by 2050. This is a 21-year research published in New England Journal of Medicine. They track walking, biking, golf, tennis, swimming, listen to music, solving puzzles, reading and writing. Guess what? The only physical activity shows the result reducing risk of dementia was dancing, the highest by 76%. Can you guys guess why? Anyone? They said it's a tribute to rapid fire decision making. So when you think about it, walking, repetition, right? Do I have to think? No, right? That's why so many people walking with their phone and then run into someone, right? Running, faster repetition. Biking, same thing, faster repetition. And what's amazing is that golf and tennis doesn't reveal any results either. So why dancing is unique and different? When you think about it, um, the rapid fire decision making happens when your logical side brain is doing mathematical calculation of the musical beats. So 1, 2, 3, 1, 2, 3, 4. In the split of a second, you have to transfer that signals to every single part of your body and counting the same mathematical beats in an artistic, beautiful, expressive style, however you want. And at the same time, it's so much fun that you forgot that your brain is working so hard, making decisions. You just keep going, right? And that's why dancing not only provides the physical, emotional benefits, huge part provides the brain benefits. Every 11 seconds, an elder fall, go to an ER. Every 19 minutes, an elder die due to a fall. Dancing improves balance by 50%, prevents falling. My mom, unfortunately, recently had a fall. And she's got a fracture here. So now she's frustrated because she can't cook. And, she's right-handed and she likes to clean the house. She can't do any of that. And she's one of the lucky ones, right? It's just this. Many elderly, unfortunately, after fall, they die within a year. About 50% die within a year. 1 in 3 deaths in the US is due to cardiovascular disease. This is a 48,000 patient study published by University of Sydney. Revealed dancing reduced 46% of cardiovascular death. So why are we unique? I myself have 15 years of human-centered design and behavior strategy background. We are also mentored by B.J. Fogg, a Stanford professor who heads up their Persuasive Tech Lab, and the founder of IDEO, David Kelly, as well as Design for Health at IDEO, Dennis Boyle. I myself done a bunch of machine learning and AI projects when I was part of the AT&T Interactive R&D, which is a sister organization of Big Bell Labs. So with cancer, what impels me to do is I have all these skill sets that helping corporation making tons of money before. But this is the first time I'm gonna take in all these talent and then make it unique and different for many patients and many elderly like myself. And so what the AI does is provide you the highly personalized recommendation, matching you to the most compatible buddy and allow you to cultivate healthy behavior change in a supportive way. So BJ's model is instead of trying to create human motivation, which is very difficult, we increase ability by providing a 24/7 accessible live video platform with pre-recorded dance video. And we bring the most powerful behavior trigger. If you're in a group, you're more likely to accomplish your goal, but you really excel when you have a buddy. So we have the group classes where you can attend in person. You can also attend remotely online. And then you have a dedicated buddy that based on your preference and your personality types. And you get to choose anytime you want to dance together with a minimum requirement of 3 times a week and 30 minutes each day. Oftentimes our patients say they do more than that because they're just having so much fun with another person. So this whole process is make it easy and fun and could be addictive. I myself don't have any healthcare background until I got sick. My background is mostly in innovation and design and technology. So trying to innovate in healthcare is very difficult. I sympathize with you. And so, but this is what keeps me going. Our patients' endorsements. And when I realize how much impact that we have created for them, all they're looking for is come to our Dance for Healing program during chemo. It makes me happy. Our program is Net Promoter Score is 91 versus the industry of 24. NPS is what you recommend this to friends and family. Majority also reported pain reduction, anxiety, depression reductions, as well as energy level increase, quality life increased. So we are setting up a clinical trial, and we do have the doctors on board with a combination of integrated medicine, geriatric care, as well as the technology and the music therapy. However, I don't have any grant writing background. There's tons of NIH grant, SBIR grant we could apply for. And so if you guys know any grant writers that can help us polish like a 70% done proposal, that would be extremely helpful. We won about 15 awards, including Stanford Medicine X Healthcare Design Award, where I got like whole room to dance, about 200 people. And APA, guess what? According to them, the stress management tool, the most popular one, is 47% listen to music, 46% exercise or walking. So by combining the two most popular stress management tools, and with the upcoming trend on telehealth, and now 71%, it's open to telehealth, we can help a lot of people. So after speaking in many conferences, and also demo presented, still trying to figure out how to make my company sustainable, what I realized, half of my job is public education. This is why I'm speaking here. All these data, you guys probably didn't know. Anybody was surprised by my data today? Right? Yeah, so stage 4 is a personal journey. I'm turning my last 5-year creative writing into a book for stage 4. And then I'm launching a web magazine dedicated to raise awareness of power of creative arts therapy. So we're gonna have 4 sections of content. First one is inspiring stories from patients and caregivers. The second session is about published medical research, turn them into common language where everybody can understand. The third section of content is innovative approach. We could showcase yours too. And then the last one is practical tools, like healthy living tips and tools, where the audience can take it and apply it to their life. We're also setting up an interview series. So if you are an expert in this field, let us know if you're interested in being interviewed. We're also looking for community leaders. So what I want to build is an ecosystem of community leader, because I'm only one person. I can speak here, but if you guys all help me spread the message, and whatever the area you are, together we can make a huge impact. There's also an opportunity provided by PBS producer American Health Journal that was interested in doing a documentary about my story. So we're looking for underwriters who will support the seminar mission. So if you know any underwriter will support my documentary with PBS, also let me know. So join our movement. Hopefully this is refreshing for you. And we do, some as this last entrepreneur, we also need a lot of help. We need impact investors. We really need partnerships because it's difficult for our tiny little staff to constantly knock at this large corporation's door. And it's a slow process. Currently, I have like 5 corporation contracts pending. It's been like walking like a snail. It's pretty slow. Yeah. And then, healthcare business is not something that I'm familiar with. So, if you are good at that, and we also need to make sure our technology is scalable. And so if you know somebody or yourself good in that, please let us know. Lastly, I want you to meet Annie. Can you play that video?
Mi va piccola, mi va. Mi ho vivo, mi ho la mani, mi ho la va, mi ho la mani, mi ho la into the exercise room.
That was awesome! Yay! Yeah, so Annie has dementia. She was not able to interact with us, so she decided to dance for us. So help Annie, help us. Together, we can help a lot of people. One dance at a time. Thank you.
So we'll open it up to the audience for a couple minutes. Any questions? I found that very interesting. A couple things I was thinking about as far as dancing, I felt like you've kind of touched on multiple different things that dancing can kind of bring to someone. And it seems like there's social, there's creativity, there's the physical exercise itself, listening to music. What do you think is maybe the major determinant of the benefit of dancing? Do you like, or is one of those a category, or potentially are all of them immediately required, and you almost don't think you can get really a benefit without kind of everything together?
Compared to other modalities?
Potentially, or just in your own thoughts of what do you think?
Yeah, so I think what we dance for healing, we stand for all bucket of creative arts therapy. And I have to say, based on all the medical research we gather, dancing was the most powerful one because it's not only for your emotional intervention right on the spot, like real-time emotion intervention, it can also provide the physical activity or exercise. And then in addition to that, it provides the neural benefits. Yeah, so it's like a whole body.
Another thing I was wondering was, what do you think are some of the barriers that you have either encountered or expect to encounter when you're trying to implement? This sounds like a fairly large program.
Yeah, so certainly there's definitely a lot. I guess the one of the biggest challenges, this is why I do public speaking and I wanted to launch this work magazine, is like these data, they all published in medical research. And NIH probably spent tons of money on them and they're not being implemented, right? And then so you guys are not alone. Like oftentimes I speak at conferences, like when I ask them if anyone know any of the data, it's silent, right? Everybody loves music and dance, but these are doctors and healthcare executives. They don't know about the data. The other thing is also creative arts therapy falls into integrative medicine. I know we all know integrative medicine nowadays still struggle, right? Like, acupuncture is not even reimbursed everywhere. Like I work with, director of integrative medicine in Stanford, but even that, I understand his challenges too, right? So like, until you guys help us raise awareness, there's always going to be challenges where people just being very skeptical, and this is also why we are setting up the clinical trial. Even though we don't have research backgrounds, because we wanted to prove, in addition to these published medical research, music and dance can also be provided remotely. For those patients who stuck at home, have no easy access, to a gym or go out to a studio, right? Like for me, when I was going through cancer, my immune system was compromised by chemo. If I go to a gym and if I'm mother elderly couldn't even go because due to inability to travel, difficulty with driving. We're actually setting up an intergeneration matching program, so I enable teenagers to help elderly because as a behavior design human center expert, we conduct a lot of interviews. And when we visited these elder center, like the most popular activity was music and dance. The second was the intergeneration program. So they have these little kindergarten that come in to play with the elderly or high schooler come in to like, work with them, do things with them. So we also bring those components in.
Perfect. That was a great and very interesting concept and something that I don't think we're quite aware of.
So I didn't pay careful attention to the videos, but I feel like from experience, I know that women like music and like to dance perhaps more than men. So have you addressed that, or have you figured that out in any way, or tried to solve for that because men have the same, can benefit in the same way, or will they, or can they?
Yeah, so we have knew that since the beginning actually. So yes, it's not like men cannot dance. It's the society, the societal concept makes men feel they're less comfortable dance. After beer, we all dance, right? And so the truth is, when we talk to BJ Farr, and his advice is like, you start with the people who love to dance already. Because trying to create human motivation is difficult, right? So you don't focus on that. You focus whoever is already motivated, and then you put hard trigger in front of the motivated people. And you allow them to adopt the platform, the technology, and then now they're going to become champions for you. And so this way is much better way and easier way to implement anything or launching anything. However, you don't ignore their motivations. You just don't want to create motivation for them. And so with motivation, what you do is an empathy study to understand what their motivation are. So like say for an elder gentleman, his motivation might be just going out with his wife somewhere, right? If the wife like having so much fun, understand that medical benefits behind, like dance is gonna help her husband have less risk of dying from cardiovascular disease, she's probably motivated to get him to exercise, right? And in that case, you're not forcing him to do it. You allow her to learn the benefits, and then sort of being the champion for her husband and more in their both journey of getting better. Yeah, so it's interesting because a lot of behavior design program out there try to create motivation and oftentimes fail because it's just simply hard to create motivation. And like say for example, our patients, like a lot of these patients, like their motivations, they want to live well and they want to see their kids growing up. But do they realize by doing more dance, they can, live longer and see their kids growing up? Not necessarily. But then when they learn the medical research, their motivation started to realize, oh, wait a second, by doing more dance, I can actually live longer. I can actually take my kids to travel. So you're kind of helping them bridging the gaps where they can see, how this could help them, like in line with their motivations.
It's great.
Okay, thank you.